demonstrate an activity, supine to sit and sit to stand, that we would use on a patient on a category yellow. The easiest way to transfer a patient from supine to sit is actually to have the patient, educate the patient. That's what we're going to do. We're going to inform the patient that we're going to transfer you from supine to sit. So we're going to be able to get up. And first what I want to do, we're going to bend your knees. So if they can bend their knees, you want them to bend their knees. If the patient can't bend the knees, you can actually also raise the bed from the lower part. And what we want to do is roll to your side, okay? And they can help by rolling to the side, okay? Now they're going to use their arms, and you're going to use their arms to push up and swing the legs, okay? Okay, so now that we've positioned the patient and they're sitting at the edge of the bed, we want to transfer them from the bed to the chair. We want to use a gait belt for safety. Okay, we want to lower the bed as much as we can. Bring the wheelchair as close as you can, usually in an angle, secured by the brakes. Okay, now we want the patient to scoot to the edge of the bed. You can help them by moving them from the buttocks area. If the left side is weaker, we want to put the wheelchair on the right, and we want to block the left leg with our knees. Okay, we don't want your hands to be over you. You want to instruct them to put their hand is going to try to go towards this armrest. Okay, ready? You can lean forward, guide them to stand, turn, and lower. Okay, see how I kept the curves of my spine and I was lowering my knees. And this that I have one knee in front of another, it's called a staggered gait, the staggered stance. Okay, so now we're ready to put our patient back to bed. And since we said this patient had a left side weakness, we're going to bring them back to bed in the other side. So we position the wheelchair with the right side, which is their strong side, closer to the bed. Okay, we want to make sure that the patient comes to the edge of the chair. Okay, we want to make sure that they use their good strong arms to push off. Okay, even if this one is weaker, we still want to kind of reinforce them by touching the patient, telling them what we want them to do. We lower the bed as much as we can. In this case, it doesn't lower that much. Okay, so with this strong leg, I want you to stand up, and then we're going to guide you back into the bed. Okay, okay, ready? 1, 2, and 3. Okay, and return. Okay, so now we're sitting at the edge of the bed, and we want to make sure that we bring them back to supine. Place your hands to the side. You want to make sure you instruct the patient that they're going to go and lay down on your side, and I'm going to help you with the legs. Stay on your side, and then you're going to roll over to your back. Okay, so when we're ready to ambulate a patient, we want to make sure that we use the plastic sanitizable gait belt that we can use between patients. Make sure the patient needs to scoot forward to the edge of the chair. Okay, put it around their waist. It's a little lower. Follow your back. Keep your back straight. Right on your waist, nice and snug. Because otherwise, once you stand up, it's going to come off loose. Okay, have the patient help you with your arms. Okay, and you're going to grab them firmly from the back. Okay, if needed, you can hold them from their hands. Okay, and slowly walk. This is your first time walking, so you want to take it easy. Short, nice little stroll. Okay, so you're standing slightly behind the patient. Okay, and let's turn around. Walking back to the patient. If any case she loses her balance or knees feel a little, just step back and have them lean on your knee. From there, you can either slide them down to the floor or help them regain balance coming forward. And slowly come to the chair, hold on to the armrest, feel the chair behind the knees, and slowly lower the patient.
pink slip is a friction-reducing device to aid in repositioning and lateral transfer of patients. It is designed for single patient use, but can be used repeatedly for the same patient during their stay unless damaged. Do not leave under the patient after use. Store at the bedside.
So before we do the transfer, we can remind ourselves how we want to do it. If we're doing a lateral transfer, we want to make sure that the sheet is a little further out. My arms are going to be extended, the front leg is going to be bent, the back leg is going to be straight. So I'm going to be coming from this motion back. So from here, elbows back to my body. Okay? And when I'm doing a repositioning up in bed, I want to be shifting the weight from right to left or from one leg to another. Keep your elbows closer to your body and just kind of stance position, and you're going to be going this way from here to here. So if I was moving the patient, I'm going to be going from here to here, here to here. Keeping your back straight and your arms close to your body.
Before beginning, adjust the height of the bed. If there is a height difference between caregivers, adjust for the shorter caregiver. Since we'll be doing a bed boost, this is a good time to place the bed in reverse Trendelenburg. Bend the patient's knees and turn toward you, asking the patient to hold the bed rail and pull to assist. If needed, use the draw sheet to finish turning the patient toward you. Unfold and flatten the pink slip. When placing the pink slip under the patient, make sure the arrows are pointed toward the head and feet, the direction of patient movement. Fold and insert the pink slip between the bed and the draw sheet. Release the patient and repeat turning technique in the other direction in order to pull the pink slip through to the other side. If only one healthcare worker, be sure to use the bed rails when changing sides. Make sure the pink slip is under the shoulders, head, and hips of the patient. Contract your abdominal muscles to support the spine. Keeping the knees bent and your elbows close to your body, shift your weight using the legs in the direction you want to go. Do not lift, simply slide the draw sheet over the pink slip to move the patient up in bed. When doing a lateral transfer, position the draw sheet with the longer length on the side you will be pulling from. Insert the pink slip with arrows pointing from side to side, the direction of patient movement. If using a slide board, insert it between the bed and the pink slip. Slide boards can be used to assist the bridge of two uneven surfaces or to make transfer easier for larger patients. Prepare to pull the draw sheet across the pink slip and slide board if you are using one. Extend the arms and position one leg forward. When ready to transfer the patient, pull the draw sheet by moving your arms closer to your body and shifting your weight to the back leg. There is no need to lift. The pink slip will loop over onto itself, reducing the amount of force required to make the transfer. For struggling patients, loop longer sheet over the patient to control arms and use a separate draw sheet to wrap around the patient's feet to assist with transfer and prevent kicking. When ready to transfer the patient, pull the draw sheet by moving your arms closer to your body and shifting your weight to the back leg. The Hovermatt and AirPal are patient transfer devices with mattresses that float on a cushion of air for safe and easy patient transfer. We have mattresses and air supply devices from both companies, and their parts are interchangeable. The mattress is radiolucent and artifact-free, so safe for all radiographic procedures. This device is used for patients in red and some patients in the yellow category. Use the roll technique to place the mat under the patient. Make sure the foot end of the mattress is at the end of the bed. Center the patient on the mat. Secure the patient using restraining straps. Attach the flexible hose to the opening in the corner of the mat and snap into place. Raise the bed so it is slightly higher than the gurney, letting gravity assist in the transfer from higher to lower surface. Set the brake on the bed and gurney. Plug in the air supply, then turn on while monitoring the patient. When the mat is fully inflated, grasp the handles. If working alone, pull the foot section first, then transfer the head section. Be sure to use the handles and do not use the restraining straps to transfer the patient. Make sure patient is well centered on the gurney. Turn off the air supply and mattress will deflate. Use the roll technique to remove the mat. Never leave a patient unattended on an inflated mat. Patients can be left on a deflated mat without concern for skin integrity.
Log roll the patient on their side away from you. Position the sling so that the handles and logo are facing the mattress. Tuck half of the sling under the patient. Center the sling on the patient's spine with the top of the opening of the sling even with the base of their tailbone. Roll the patient toward you and pull the rest of the sling out the other side. Lay the patient on their back. Make sure the sling is centered underneath the patient. Lift the patient's left thigh and pull the left wing of the sling under the patient's thigh. Then place the excess wing over the top of the patient's left thigh. Repeat this step on the right thigh. When you are completed, the patient is now ready to be lifted. Note, if the patient's legs are extremely rigid, it may work better to bring the left wing under the right thigh and the right wing under the left thigh instead of going between the patient's legs. Position the lift until the green rubber hose is over the patient's chest. Make sure there are no cords or other objects under the bed that would obstruct the wheels of the lift. Each sling has 3 different loops. These loops are used to determine the position of the patient. The shorter loops bring the patient to a more upright position, and the longer straps leave them in a more reclined position. Typically, applying the shorter loops on the back and middle loops on the front provides a comfortable transfer. Attach the straps by the patient's shoulders to the lift using the shortest strap. The hanger should be positioned as shown and be parallel to the patient's shoulders. Take the wing that is lying over the left leg and hook it on the right hook on the longest loop. Then take the wing lying over the right leg, cross it over, and hook it on the left hook on the longest loop. The patient is now ready to be lifted. Push the up button on the hand control. Once there is tension on the loop, double-check the loops to make sure they are securely in the hooks. Start lifting the patient to the desired height. If the patient is not able to support their head, assist them or use a head support sling. Lift the patient's knees and smooth out the sling under the thighs. Then, continue lifting the patient to the desired height. There may be instances when patients with extremely fragile skin will require a different sling, such as a multi-purpose sling. With the spreader bar and legs opened, position the wheelchair under the patient. Stand behind the wheelchair and hold both of the side handles on the back of the sling or the middle handle. Hold your hand level and lock your hand against your stomach as the patient is being lowered. When the patient is 1 inch from the seat, grab the handle and position the patient comfortably in the wheelchair. This will ensure that the patient will be seated in an upright position when fully seated in the wheelchair. Unhook the sling from the EZ lift and back the lift away from the patient. Lift the patient's knees, pulling the sling wings out from underneath the patient's thighs. Lean patient slightly forward and grasp the top of the sling and pull the sling out from behind the patient. If you choose to leave the sling in the chair with the patient, simply tuck the wings between the patient's legs and the sides of the chair. We will now demonstrate how to transfer a patient from a wheelchair. When standing in front of the patient, lean them forward several inches to facilitate the positioning of the sling behind the patient. With the sling handles and EZ-Way logo toward the chair back, place the sling behind the patient, keeping the center handle of the sling centered on the patient's spine. Make sure the opening of the sling touches the patient's tailbone. Position the wings along the inside of the chair. Place your hand between the patient's hip and sling with your fingers pushing down on the edge of the sling to the chair bottom. Lift the patient's left knee and with a tug, pull the left wing of the sling under the hip and thigh. Place the excess sling over the left thigh. Repeat this procedure on the opposite side. This procedure will ensure that the sling is under the patient's bottom, with the patient's weight evenly distributed on the sling. Use the spreader bar to spread the legs wide enough to straddle the wheelchair. Position the lift so that the green rubber nose is now in front of the patient, with the hanger spreader parallel to the patient's shoulders. Attach the lift shoulder strap to the left hook and the right shoulder strap to the right hook. Take the right leg wing and attach it to the left hook using the middle loop. Take the left wing and attach to the right hook using the middle loop. Push the button on the hand control. Lift until there is tension on the wings of the sling, making sure all of the loops on the sling are securely hooked on the sling hanger. Then smooth the sling's wings under the patient's thighs with a slight pull on the outside seam of the wing. Lift the patient off the chair. Once the person has been lifted, they are ready to be transported. When using the EZ lift for transferring patients, lower the patients so that their feet are resting on the base. This will make the lift control and turn more easily and give the patient a greater feeling of security. EZ-Way slings are designed for easy toileting. After the patient has been transported to the bathroom, position the lift around the toilet and lower the patient. Now demonstrate how to lift a patient from the floor. One person can lift a patient from the floor, but it's easier when there are two people. Place a pillow under the patient's head. Position the sling using the same procedure used when transferring the patient from a bed to a chair. Log roll the patient to position the sling underneath so the handles are facing the floor. Using the center handle as a guide, center the sling on the patient's spine with the opening of the sling even with the base of the tailbone. Make sure the sling is centered underneath the patient. Lift the patient's right thigh and pull the right wing of the sling under the patient's thigh. Repeat this step on the left thigh. When you are completed, put the straps on the patient's chest. The patient is now ready to be lifted. Move the lift into position around the patient. Lift the patient's legs to one side, pushing the lift forward until the green nose cone is centered on the patient's chest. Then lay the patient's legs over the base of the unit. Lower the lift boom and hook the straps to the lift hangers using the longest loops and shoulder and leg straps. Support the patient's head and start lifting the patient. When the patient is off the floor, rotate the patient's legs away from the mast. Continue lifting until the patient is at the desired height. Roll the patient into position next to the bed. Swing the patient's legs up and around and center their feet at the foot of the bed. Reposition the patient so they are centered on the bed. Lower the patient. It's recommended to support the patient's head during this step. When the patient is fully lowered, remove the sling straps from the sling hangers. Using the log roll method, remove the sling.
The Hovermatt and AirPal are patient-transferred devices with mattresses that float on a cushion of air for safe and easy patient transfer. We have mattresses and air supplies from both companies, and their parts are interchangeable. The mattress is radiolucent and artifact-free, so it is safe for all radiographic procedures. This device is used for patients in the red and some patients in yellow categories. The Hovermatt and AirPal are patient-transferred devices with mattresses that float on a cushion of air for safe and easy patient transfer. We have mattresses and air supplies from both companies, and their parts are interchangeable. The mattress is radiolucent and artifact-free, so it is safe for all radiographic procedures. This device is used for patients in the red and some in the yellow categories.